debrief of the recent GFF Investors Group meeting that was held at the end of June in Geneva. And we will also be providing country updates on progress that were discussed recently on a GFF Secretariat call. We are pleased to be able to provide you with these webinars on a regular basis. This follows the most recent webinar that was a briefing prior to the Investors Group meeting. We will follow the same format. So we will have a couple of speakers, Mesfin Teklu and myself, speaking about the IG meeting. And then we will go into the country updates. Please, if you are on the line as a presenter, please mute yourself so that we don't have any interference on the line. And for everyone who is participating on today's webinar, please send in your comments or questions through the chat window, as we have done in the past. The logistics are the same. And so we will be collecting comments and questions over the course of the presentations, and then we will try to respond to them as best we can in the latter part of the webinar. So we will be getting started. Mesfin Teklu from World Vision will be speaking first. He will be giving us an overview of the Investors Group meeting. He and Joanne Carter are the civil society representatives to the Investors Group. Joanne Carter was unable to attend the last Investors Group meeting, and so I, Christine So, attended as an alternate, so that we did have two civil society representatives at the meeting. So after Mesfin has given his overview, I will chime in with any additional points. And then we will move on to the country updates. So with that, Mesfin, are you on the line? Can we get started?
Yes, I'm here. Can you hear me, Christine?
We can. Thank you.
Thank you very much, Christine. Hello, everyone. Greetings wherever you are. It's great to see this our regular update on the GFF, and as Christine outlined, myself and Christine attended the third Investors Group meeting in Geneva on the 23rd and 24th of June last month. So it was a one-day meeting. On the 23rd, there was evening kind of networking event. So this time, the third investor group agenda or the meeting was basically focused on providing the IG investors group on portfolio and progress in one country, mainly from DRC. And then there was a session on complementary financing presentation by key financiers, including USAID, Gavi, Global Fund, JICA, and which is Japan. I believe those are the donors that have presented. And then we had a discussion on a result framework of the GFF, and then a paper presented on the GFF work on commodities. We were supposed to discuss on the GFF governance, but we ended up talking about in the last agenda how to, the approach the remaining facility countries, and the letter that was supposed to be sent by the Secretariat a while ago. So with that, I will just, highlight key issues that as civil society we highlighted. On the country update, we had actually extensive presentation by Dr. Felix, who is the Minister of Health from DRC, in terms of the investment case, the priority areas within the investment case, some of the indicators they use in terms of selection of implementation area, whereby the investment case prioritized 13 provinces using 4 indicators, which include neonatal mortality, chronic malnutrition, which is in stunting, under 5 mortality, stunting in under 5, contraceptive utilization rate, and then early fertility among adolescents. So with that, he quite went into much detail in terms of what they have been able to prioritize within the investment case, some of the challenges they face in terms of bottleneck analysis, mainly financial accessibility and geographic accessibility, and quite detailed plan in terms of monitoring and evaluation framework and the challenge they are facing in terms of financing the plan and the resource mapping. So it was quite elaborate discussion, and of course we did ask in terms of the country platform and who are the civil societies are engaged in that country platform. We are given very general kind of feedback in terms of the NGOs who are providing service, as well as some of the network, including the SUN and National Health Care Steering Organization, and then women's related organization, which have been organized by the government. So it was quite difficult to understand actually the scope of civil society engagement in the country platform. But that said, I think the presentation gave a very good overview of the process the country has gone through in terms of the key areas of focus within the investment case, the process they have followed in terms of developing the investment plan, the key stakeholders involved mainly from the donor side, with some civil society engagement, which I mentioned some of them that have been mentioned, and quite elaborate discussion to understand the country process. So I think we'll come back to the country update when we will discuss. I think Kadi will present on the country portfolio, which I will comment later on specifically about the portfolio. But I just want to say that, in this time of our meeting, it was quite good to hear donors highlighting the role of civil society both in implementation, accountability, as well as implementation, accountability, and service delivery. So I must mention here that especially Canada was quite specific in terms of asking the countries to highlight the role of civil society, and I think Christine and I were quite happy and pleased that the question about civil society engagement were not necessarily us asking that question. It's the donors themselves are asking the countries, to embrace multi-stakeholder platform, including civil society, and I think that was quite encouraging for us to observe in the meeting, such question coming from the donors, and I think that is a realization that, in order to make progress on the GFF process in country, I think the role of stakeholders, including civil society and private sector, are indispensable. So we're actually encouraged on that discussion. Of course, there was discussion, a number of issues on the complementary financing. We had a presentation by USAID about their engagement with the GFA process in the country. As you know, the USAID is has a decentralized structure, and they mentioned about Ariel mentioned about the USAID approach in terms of supporting GFF, and mainly direct contribution of financing to country-specific trust fund. He went on mentioning about the work they did in Tanzania, the $50 million trust fund that is put in alignment with the investment case by USAID, and they mentioned about the $18 million put together to support Kenya in terms of the technical assistance for the counties. I think the lesson from USAID presentation was basically they are looking at alignment of USAID investment with investment case. They are not necessarily contributing to the funds to the facility as a country, sorry, to the trust fund, and highlighted ownership and readiness of key stakeholders, and of course highlighted as a challenge limited civil society participation in some of the countries. That was, some of the key points highlighted by USAID. And of course, Japan also made a presentation in terms of their support to GFF in Kenya, Bangladesh, and Senegal. And many of their assistance for Japan is more of a loan, a concessional loan in support of the investment case, and mainly related to health system strengthening and development of policy for universal health coverage in Senegal, and to improve health system strengthening in Bangladesh, and then health sector policy plan development for Kenya. So that was Japan's contribution, and they shared how they are aligning their country support with the GFF investment case and priorities. And we had a presentation as well, Gavi, in terms of the Gavi work toward this health system strengthening and their special focus on equity. I think that was quite clear, and they see that the GFF process is a good vehicle in terms of aligning the resource at the country level. And we had a presentation again by the Global Fund. Global Fund is increasingly looking at health system support as well as support to RM and CH in fragile context, and I think that seemed to be the, showing their commitment toward this investment case. And I think the challenge Global Fund has highlighted was the idea of sustainable financing for programs implemented by civil society. How do you transition Global Fund funded programs implemented by NGO, how do you transition those to domestic financing? That is the area they see as a challenge, and they are working on those issues. So I think the general consensus and the feedback for me from the complementary financing session is actually donors are increasingly using the GFF process to align a resource in the country level, although many of them are using through loan as well as trust fund. But I think the ultimate objective, the bottom line, is that they are looking at GFF investment case as a vehicle for country assistance. We had as well a presentation on GFF result on key indicators and reporting, and this is also a presentation by the Secretariat on result measurement, and we looked at the indicator that is being developed by the GFF for the investment case, and the whole idea is actually to align the GFF core indicators with the global strategy core indicators. So that was quite clear, and of course a number of questions being raised in terms of the core indicators. The GFF does not include stillbirths, yet the global strategy measure stillbirths as core indicators, and the issue around adolescent birth rate. These are the key areas that was highlighted, and Secretariat was going to look at the indicators based on the feedback that was given by the investors group. So we'll share with you whether those comments would be incorporated in the end. So again, the indicators cover a number of areas, including programmatic indicators, financing indicators, and issues around disaggregation of data. And we highlighted key issues from our perspective in terms of looking at equity when they are doing the disaggregation, and some of the indicators were problematic. I think we highlighted some of them, and I think the comments were taken, and the plan is for the authors of this document to look at their indicators in alignment with global strategy indicators, and we hope to see a revised version before it's being finalized. And the investor group also have been asked to look at the work that's being done by the RMN Sage Commodity Task Team, and in this session the investor group were asked to provide their opinion and recommendation how to continue on the commodity task work. And I think the overall recommendation that GFF will have a role to play in terms of shaping the RMN Sage commodities, and this is there are quite a number of initiatives that have been highlighted in the paper, including the UN Commission, the Commodity Commission that was doing on the similar work, a number of initiatives done by partners including USAID and a number of agencies. So we did request as well a civil society representative in the task team that has been accepted positively. So we hope to nominate the civil society, and we had an offer from PATH to contribute and participate in this working group. So that is something that we are happy to take forward. So I hope that is okay with everyone. And the other thing is on the facility countries, as you know, so far the GFF has focused on the 12 countries. Even among the 12, India has not yet decided. And in the previous investors group, there was an agreement to write a letter to the remaining countries in terms of the GFF process and the resources that are available in terms of supporting them for the development of their investment case. And I think that recommendation is still valid, and the letter has not been sent out, and I think there was for various reasons. And I think there was a recommendation by the IG that we really need to encourage these countries to continue working on that. But at the same time, the GFF secretary need to look at, maybe increase involvement of new countries in a phased manner rather than reaching out to everybody at a time. So a number of criteria have been selected, when new countries are coming to look at, their commitment to inclusive process, their commitment toward this multi-stakeholder process that put women and girls at the center, and of course the GFA portfolio mix also need to be taken into account. So there is quite recommendation made in terms of the approach for selecting more candidates, and I think there will be a criteria suggested, and based on the criteria additional countries will be included in a phased manner, and that will be decided later on based on the agreed criteria. So we didn't subcommand, or any country was not necessarily on the list, but I think the discussion focused on what criteria should be used in terms of including additional new countries. So that was basically the focus of the meeting and the agenda item. But there was also information that was shared that the GFF secretariat and function within the bank has a new leadership. I think it was announced just before the meeting that the Gate Foundation has agreed to second Dr. Miriam Carlson to be the director of the GFF at the bank, and she will have a senior role within the bank reporting to Tim Evans, and Monique and the secretariat will be responsible for running the day-to-day of the GFF, and Miriam primarily responsible for building partnership as well as resource mobilization. Christine and I had quite very good conversation with Miriam. She seemed committed to the multi-stakeholder process as well as civil society engagement, and I think we felt encouraged actually with the conversations that we had with her. So we hope to follow up with her once she assumed her role in October 2016. So that is probably, I should stop there. Maybe I will let Christine to add or comment on what I have already said. Thank you.
Thanks very much, Mesfin. Yes, I think you did an excellent job covering what was discussed at the meeting. Just a couple of points that I wanted to make, some of which will just support what you said, and probably all of them are just in support of what you said. I was particularly struck when we heard from the Minister of Health from Republic of Congo that he really emphasized the idea that having GFF as a process and a mechanism was acting as a catalyst in how they were doing their planning. He was very articulate around that, and he was pressed on this question by members of the investors group in terms of, what was his opinion of how useful GFF has been, and would their planning process have been improved without the presence of GFF. And he did speak quite convincingly about the fact that the presence of GFF meant that there was better collaboration and a better, more streamlined process for planning, and better partnership around planning. So I think that is important. It's one of those things that's kind of hard to measure, but if GFF is having, in fact, that effect, that's probably a positive impact of the process, without taking into consideration the question of the actual financial levels that it's introducing. The other point that I just wanted to underscore, and Mesfin spoke to this, is that I think we were both very positively impressed by the attitudes of other IG members who were there, in particular some of the donors who were asking questions about the participation of civil society. Miriam Clayson from Gates was very positive about making sure that civil society is better engaged, and was interested in hearing our input and feedback about how this had been managed thus far. And she is coming on in October, but is already very involved in the process, as we saw from her involvement at the IG meeting in June. And the Secretariat, various people from the Secretariat have also been very clear about the fact that they feel like they're finally getting some of the resources internally that they need to be able to take this forward without working 24 hours a day. So there were some overtures from them about picking up this conversation about civil society engagement. I know that all of us feel like we have been talking about it for a long time and saying the same things probably over and over again without getting a whole lot of movement forward. I'm hopeful that we are getting to a point where we may actually be able to get some traction on some of this stuff. And I think importantly, it is valuable that we can say to them, we have already done a lot of thinking about this. We already have sketched out how civil society needs to be involved, what some of these structures can look like, that we are being very clear that we're not starting this discussion now, that it has already been in discussion for quite some time. And along those lines, the GFF Secretariat did adopt a private sector strategy earlier in the year, and so there was some discussion about the possibility of having an actual civil society engagement strategy. So that is one point that needs to be discussed in more detail with the Secretariat. The issue of the country platforms and how civil society is participating and contributing to the country platforms also remains a more kind of structural, formal piece that needs to continue to be pushed, I think, by us, and to be and to evolve as this all goes forward. The last thing I'll note, which actually isn't so much around the IG meeting, but I think is of interest to a lot of us, is that there is the question of the communication strategy and the website. The GFF website is active, but still does not have, I think, a lot of the information and documents and resources that we are hoping that it will have soon. We have had some discussions offline with members of the Secretariat about this, and fully recognize that the documents, especially the investment cases and timelines for the various countries, are not as available as we feel they need to be. to allow for full participation and transparency. So I think that that is one point that remains not as evolved as we hope it will be, and that's something that we will be continuing to press around. So I'm going to stop there. Just to remind everyone that you can submit comments through the chat box, and we will be responding to them over the course of the webinar. So please go ahead with any comments or questions that you have. And then I will ask Kadi Ture, or well, Kadi or Mesfin, I'm not sure which one of you wants to go first around the country update. We have a country update that's included, that will be included in the presentation here, and then Kadi is also going to speak more specifically to the work that's going on around CRVS. So actually, Mesfin, why don't I ask you to start, and then Kadi can take it from there.
I think Kadi was going to start. I didn't attend what's called the CRVS webinar, so maybe I'll let Kadi speak.
Okay.
I'm happy to start with the CRVS update, and I did have a couple of questions around the IG, and thank you guys for such a comprehensive feedback, and it sounds like it was an extremely positive meeting. And I wanted to know from the both of you, it sounds like there was an undercurrent of support for an appropriate multi-stakeholder approach to the platforms and the GFF investment cases, and it sounds like multiple things were discussed. For instance, the Global Fund talking about how it uses its civil society funding for broader purposes. Christine, you mentioned the Secretariat saying whether they had a bit more capacity to support different things, including perhaps an engagement strategy. And so I wanted to know whether anything concrete had come out of how to strengthen civil society engagement writ large, or civil society or multi-stakeholder engagement in the platform. So I don't know if you want to answer that, or if you want me to just go on to the CRVS and we can deal with that later.
Yeah, just I can jump in here, Kadi. Thanks very much for that observation. I think, as Christine also said, we are quite encouraged actually this time that there is a strong support from the members of the IG for inclusive process at the country level. So for me, the opportunity that we have is that we really need to provide concrete kind of feedback to the criteria they are developing for selecting more candidate countries, which is, as the GFF is expanding, knowing that there is limited resource, and they would like to go in phases. So, when new countries are coming, they will be assessed against their commitment to multi-stakeholder process, mainly that put women and girls at the center, and of course commitment to inclusive process. For me, that's quite strong, and I think gives a strong signal that the GFF is actually looking at the country platform to be that kind of inclusive process. So we really need to provide feedback for that to ensure that those criteria are strong. The other thing is, of course, the guidance document, which we have been advocating for inclusion of the minimum standard in the country guidance document. And I think, as we updated for the coordinating group, that country guidance document has not been finalized or drafted even. So we have not seen any draft. So we did discuss with the Secretariat where that work stands, and they acknowledge that they have not been able to make progress, but I think they have hired someone to help on that drafting. So once we get a draft, then we should be able to review it critically and provide input. So those are the two pieces of work I think are immediately critical for the civil society to look at and provide feedback, and that's where I see the opportunity immediately.
Thank you, Mesfin. That was helpful.
Yeah, and this is Christine. I think that I just, again, agree with what Mesfin said, and I think that the more that we as civil society can be concrete in continuing to press for our particular points of action, both at the global level and at the country level, we are going to see forward movement. I think everybody does acknowledge that this has to be a multi-stakeholder effort. But we need to think about how that can be articulated in a more concrete way. And so, doing some of this work on, for example, an engagement strategy, I think would be helpful.
Okay, that's very helpful. Okay, Christine, do you want me to quickly go over the presentation?
Yes, please.
So the last monthly update of the GFF IG members was on last week and focused specifically on CRVS. As most of you on the phone know, improving CRVS is one of the 5 objectives of the Global Financing Facility, and the reasons being that it links to the objective of the GFF agenda to improve data for decision making in particular, which is one of the points that Joanne has often raised, sort of having increased access to real-time data for countries to better plan for improved women's, children's, and adolescent health. When we look at how the GFF supports CRVS, it's done in 2 ways. One, the team in DC is trying to ensure that CRVS is systematically included in the investment cases. So the GFF tries to assist the financing of large-scale expansions of CRVS, and then to specifically include activities related to strengthening CRVS in investment cases. And countries that explicitly include those activities in their investment cases can actually qualify for additional resources that can go up to $10 million. So there is quite an incentive there for countries to focus on that type of work. And the second way in which the GFF tries to do that is to engage with the Center of Excellence for CRVS, which was recently launched, and that center serves to gather, share evidence and technical expertise around CRVS. Now, when we look at the status of birth registration versus the number of births in actual health facilities, we note that birthing in health facilities actually doesn't result in registered children at all, and that's one of the reasons that disables, I think, our ability to adequately plan for children's health. And if one looks at the Vital Statistics Performance Index, which outlines the causes of mortality, we notice that most of the African countries do not have CRVS, or sort of do not have the adequate level of data to inform their plans. So what the GFF teams have been trying to do is systematically support countries in assessing where they are with the CRVS and implementing a range of activities, and also integrating that within the investment cases. So in Cameroon, UNICEF is currently supporting a CRVS assessment, and that will form the basis for the prioritization of activities related to the CRVS, and that will also form the basis for the activities that need to go into the investment case. We know that in May earlier this year there was a mission to the country to support the preparation of the CRVS chapter in the investment case, and that the country is receiving technical support by the World Bank and a range of other partners. They're looking at organizing a workshop in a few weeks, early in August, to discuss the findings of the assessment and identify what the recommendations are. When we look at DRC, they actually had a rapid assessment of CRVS undertaken in 2015. And had a project for human development systems strengthening, which was developed last year, but additional financing for that project was approved earlier this year. And it includes key activities around the development of programmatic a CRVS reform strategy, and then delayed birth registration through school-based campaigns, so allowing kids all the way through school to be able to be registered. The investment case is currently being finalized for DRC, but that does include some activities related to CRBS. So hopefully as that investment case gets finalized, we'll see some activities related to that. In Ethiopia as well, a CRBS assessment was undertaken and a strategic plan for CRBS was developed. They are only now working on the investment case, and so the CRBS will be included as part of that investment case, and the country is looking at the potential use of IDA resources to support CRBS, and some of the GFF trust fund resources as well to support that. In Kenya, the same thing. There has been an assessment and a strategic plan has been developed. There's also a national technical working group on CRBS that was established and that's functional. They've developed a project that was approved recently, so last month in June 2016, and some examples of the CRBS activities that are included are increasing the computerized vital registration services, so moving to more of an IT-based program, combining mobile CRBS outreach with health outreach programs, again, trying to use IT to systematize the access to data, adding ICD-10 abridged formula for the causes of death in the DHS, and then training of health staff in the use of these materials. And so their next steps for them, given the approved investment cases and so forth, is to actually start the implementation of the various programs that they've identified. For Liberia, again, they have undertaken an assessment and developed a strategic plan, and the results of which will be featured in the investment case. There is a mission, I believe, to the country plan for the week of July 18th, which is this week actually, and some technical capacity will be provided around the question of CRBS. Mozambique as well has undergone an assessment as well as strategic plan. They had a national technical working group that was developed, but that ceased to be functional, and the reasons for that we'd have to go back to the World Bank to ask, but I think it was due to a lack of activities identified to strengthen CRBS. They have had a recent GFF mission there, and that included some preliminary discussions with key stakeholders in CRBS. They are hoping to undertake a follow-up mission in the country in August and to provide some technical support around CRBS that would help to identify a range of activities, but also strengthen the CRBS focus section in the investment case. In Tanzania as well, there has been a CRBS assessment and a strategic plan developed with a technical working group on the issue that's in place and functional. The project for the CRBS was approved and included in the investment case. My understanding is that there needs to be some revision to the CRBS budget or activity proposed budget that might have some impact on the investment case, and that again they are going to have a mission this week that will help them work through some of those questions. In Uganda as well, the CRBS assessment has been undertaken. The investment case has been prepared and includes some activities and is due for approval in the month of July. Some of the CRBS activities specifically include strengthening the institutional capacities to deliver birth and death registration and scaling up birth and death registration services. Following the approval of the project, there is a mission again planned with no date provided, but to provide technical support, not in shaping the investment case, but rather in supporting the implementation of the CRBS activities. A couple of countries, Messin had mentioned India, where we don't know what their status with the GFF is going to be. Nigeria as well, as you've heard, is focusing on 6 states in the northern region and hasn't yet decided whether it's going to expand the GFF to cover the whole entire country. Bangladesh and Senegal have not yet undertaken any CRBS related activities. Some preliminary discussions have happened, but nothing there yet. Some of the key themes that we're seeing through all of the countries in terms of what some of the emerging activities are is a lot of focus on mobile registration, particularly for remote and hard-to-reach areas, registrations of birth and deaths in health facilities, the establishment of databases for CRVS, because those in many cases don't yet exist. Production of vital statistics, the preparation of training manuals, and training generally for CRVS staff. Some of the challenges that many of these countries are facing is the prioritization of CRVS activities. We find that a number of these countries need investments in a range of different areas, and there are competing priorities across different sectors that use the CRVS system, and the lack of data for the CRVS systems to provide a baseline for the data that we would be getting in the next couple of months and years. Again, in ensuring that CRVS is integrated in the process for developing the investment cases, there have been some issues. The working groups that are developed for undertaking the CRVS assessments and developing those strategies are different from the ones that are developing the investment cases per se. So ensuring that there's adequate communication between those two groups and an adequate reflection of priorities has proven difficult. And then in certain instances, there is an inadequacy of the funding for CRVS activities, which hampers a bit what happens and what doesn't happen. And then there are countries that may not include CRVS in their investment cases, and how does one deal with that situation? In terms of the way forward, what the team in Washington, D.C. Has identified as sort of strategic approaches that they've seen come out of some of the initial countries are, there are a number of cross-cutting CRVS activities that have been identified by a number of countries, death registrations, training of CRVS personnel. So is there anything that can be done there from an economies of scale perspective? There are CRVS activities that can be channeled through other ministries that aren't the Ministry of Health. Obviously, this data is useful for many sectors, and so how does cross-sectoral collaboration increase the resources that get behind the CRVS portfolio? And then the production, perhaps, of vital statistics with the current coverage levels for benchmarking. So the GFF Secretariat is continuing to work with UNICEF, UNFPA, and WHO in particular, and other partners to try to take a sort of country-based approach to providing technical expertise and aligning resources where possible to ensure that the investment cases provide as much coverage for CRVS as possible. So that's the update that we got from the bank. I'm happy to take any questions that I think I can answer. I'll refer quite a few of them back to the World Bank.
Kati, great. Thank you for that. I think that's a really useful update, and I know that we have all been focusing on GFF kind of writ large, and so I think it's really interesting to get a more focused update on the CRVS component of this. Just to let everybody know, we have a presentation that provides an update on CRVS that Kati has just gone through. We also have another update that provides an progress for each country. And we don't have enough time to go through all of that during today's webinar, but we will be posting those on the GHC website. So you can consult them and get the information that the more detailed information that we weren't able to cover during the webinar today. We have had a number of questions received already, so I'm going to suggest, in the interest of time, because we really only have about 15 minutes left, although I think we could go a few minutes over if Mesfin and Kati are available. I'm going to suggest that we go on to the questions and try to address them, and then We can take additional questions if there are any, and again, the presentations with the detailed information will be made available to those participating on the webinar today and on the GHC website and potentially elsewhere to make sure that people have access to that information. So we've got 4 questions up on the screen right now. We also had a comment that I just want to read and respond to quickly because it is something that we have discussed, and I think that we discussed in the IG meeting briefly. The comment is, someone has sent in, GFF is both a loan and a grant to countries like Uganda. Developed countries and other countries have faced issues of transparency and accountability. CSOs have done a good job when it comes to monitoring the utilization of funds. Thus, they should be involved in the process and show clear roles. I just wanted to say that make 2 comments in response to that. One is that I think we have all been working on putting together materials that show very clearly what the role of CSOs is and what the added value is of CSO involvement. And so that seems to be well received, and we've already spoken to that today on today's webinar. The second is that we also acknowledge that there is a potential conflict of interest or area of tension, because at the same time we would like CSOs to be receiving money and implementing under the GFF and also playing an accountability role. And I think that we all acknowledge that this is an area that we have yet to fully figure out. Certainly we've seen under Global Fund that there have been issues around CSOs acting in accountability mechanisms like the CM, and at the same time being implementers and receiving funds from the Global Fund. So we have the same sort of dichotomy now under the GF, or not yet under the GFF, but we are aware of that, and I think that that is an area that we are all trying to work through. So that said, why don't I pass the mic over to Mesfin, who can perhaps respond to any of the questions that are on the screen, and I'll be happy to chime in afterwards. Mesfin?
Okay, yeah, thanks, Christine. In terms of the first bullet point on the minimum standard, I think, as I mentioned before, that our discussion with the Secretariat was that the minimum standard will be included in the country guidance, and the Secretariat has been asked to draft the country guidance document. So we have not seen a draft, and we had discussion with the Secretariat, and they told us that they have not been able to make progress on that piece of work. Perhaps, for your information, the GFF Secretariat has been undergoing through management kind of structure within the bank, how to position GFF within the bank structure, basically, and the decision to bring Miriam and the whole aspect within the structure of senior leadership. I think they have been involved in that process, and I think they acknowledge that some work has suffered because of that. So no draft has been shared so far. That's where we stand at the moment. In terms of the commodity supply, I think the task team, what they have been able to produce, the material or the paper, was basically asking the investors group how to proceed on this piece of work. The task team identified the need for coordination both at the country level and global level, and they see the role of the GFF in terms of facilitating that. and the task team has been asked actually to further develop the options that are presented in the paper. So we didn't circulate the paper widely because it was produced as a draft as a working document for the investors group, and there was no option that is proposed. It was a request for the IG to provide direction for the future work of the task team. So the agreement was to proceed further elaborating the role of GFF on the commodity. So once that is clarified, we'll be able to communicate with this group. On the complementary financing, I don't have a specific answer whether RM and CH or including adolescent health, but the Gavi presentation didn't elaborate further on that, but I think they do acknowledge that they do support health system, they do support the vaccines that cover a number of age groups, including the adolescent vaccine for prevention of cervical cancer, but I think nothing beyond that we know or we heard. On the last bullet point, I think the civil society coordinating group has been working on developing a toolkit for communication. Perhaps maybe I'll ask Kadi to comment on that, where we stand on that piece of work, but I think we did acknowledge and start put together a plan to proceed on this piece of work on communication, but I'm not sure where it stands at the moment in terms of the work, the group that is working on this. Kadi, do you have any update on that?
Yes, Mesfin. So that's under development. We're hoping to have something by mid to late August that will be usable by all civil society organizations. I also wanted to give a quick update on two things. The strategic objective 1 at the partnership is working quite closely with the GFF on a couple of things, but is also working on developing guidance sort of for multi-stakeholder platforms. And one, they've received a draft of the country guidance notes, so we'll hopefully be able to circulate that for input before it goes back to the GFF, so that we're sure that CS representation piece gets built into it, or inclusiveness and transparency piece. And then they're going to set up a working group for developing a knowledge summary on multi-stakeholder platforms in countries as well. And we'll be open to nominations for civil society organizations to participate in that advisory group as well, to make sure that those points are reflected.
Christine, over to you.
Christine, are you there?
Oh, great. Okay. Sorry, and I was looking to unmute myself. Yeah, thank you for that. And we have actually another set of questions that are now on the screen. So we'll direct your attention to those. Yeah, I'll direct your attention to those. So Mesfin, do you want to take these away?
Yeah, I can take on the first bullet point in terms of the result framework. There is a draft indicator framework developed by the Secretariat, and in fact they worked with WHO to make sure that there is alignment with global strategy indicator framework. So the draft that was produced for IG meeting, it has been extensively reviewed by the IGs, and we provided input in terms of where we see there is a problem with the indicators. So they did go back with the feedback to further develop and clarify the point that was raised. So I just want to clarify the process that we are using for civil society engagement. Perhaps maybe this network need to know that we have what we call it the civil society coordinating group, people around 20 people who have volunteered and committed their time to review the material and provide input to the IG representative, civil society representative in the IG. So we did share the material, the first draft with the group, and got feedback, and then we actually, that is a input we got from the group for us to engage with the investor group during the meeting. But the Secretariat also have kind of what you call a code of ethics in terms of document sharing, so we are limited how broadly we can share documents. We can only share broadly once it is finalized and agreed. So we'll be happy to do that once it is agreed. But if any of you in this call think that you have the time and the resource to review and comment on the materials that are coming from the IG as we are preparing for this meeting, I think we'll be able to include you in that group so that we'll have the draft as they are being produced and shared. So that might help you to clarify where documents are available for sharing broadly and at what stage we are sharing a draft version of these different products. So just coming back to the result framework, the initial drafts were reviewed by the civil society coordinating group, and those input feedback have been given to the drafting team, and we hope to get another version which we'll share back to the group, and then once it is finalized, then it will be posted for public utilization at the PMNCH Global Health Council as well as GFF website. But we also hope that those indicators are the ones that are going to be used for the country result framework. That is what's being agreed. And the secretary at the investors group want to use basically the country process in terms of reporting. They don't want to use additional reporting for the indicators. They want to use existing reporting either through their SDG or the global strategy or any reporting mechanism they have adopted in country. In fact, the Minister of Health from Ethiopia went on further to say that, you know, for them to be able to change indicator, it is going to be quite significant change in terms of their system. So they strongly believe that, you know, the indicator they have and the country process for reporting. But again, we hope to see actually that the indicator recommended are included in the result framework. So that is yet to be seen.
Great. Thank you, Mesfin. And yeah, I think that the other point around indicators was that everyone is very aware of the work that's going on for the Health Data Collaborative and wanting to make sure that there is a lot of complementarity and collaboration between the work that's being done there and the work that may be done just for GFF. Mesfin did mention that you know, they are trying to make the reporting frameworks as aligned as possible with data that is already being collected. But I think that there is still this outstanding question of how much will there be a standardized list of indicators that all countries will be reporting to, and how much will countries have the flexibility to identify their own indicators. And we continue to have the challenge around financial tracking and how you know, how financial information will be managed and monitored and shared. So there are still very much some outstanding questions around the indicator frameworks. So I think we've already heard about the country guidance documentation. So maybe I can just ask Kadi to take the last question, and then we're going to have to wrap things up. Kadi, we've got a question about technical support being provided to Liberia in CRVS. How is technical support being provided on investment case development in this case and more broadly?
So I know that the technical support is being coordinated by a sort of subgroup of the IG. In terms of how it's being provided on a case-by-case basis, I would have to ask the World Bank and refer back to the group because I'm not aware.
Thanks. And I think that we have certainly heard, for example, from USAID that one of the things that they have been doing is, while they're not necessarily including their funding in pooled funding mechanisms, we know that their people in country are providing technical assistance and helping with some of this work. And I think that we're seeing that from various donors and partners. So the question of technical assistance has been one that GFF has been looking at for quite some time. There was a paper written around technical assistance early on when the IG was formed, and I'm not sure if that actually really went forward or not, but certainly there is interest from donors to provide technical assistance. And we, even on this call, have talked about some of the areas that require it, including indicators and results framework and adolescent health, where that technical assistance is very much necessary. So with that, I think there's one last question. Danielle, do you want to move us forward? There we go. Sorry, just very quickly, and this is a comment and very much along the lines of what I was just saying, adolescent health and family planning are not coming up strongly in the GFF, yet in developing countries there is need to increase finances in these areas. Is there a possibility of prioritizing these areas? Well, I think that GFF is intended to work on these areas specifically. I will say that I think we've all been impressed by how active the civil society groups have been in continuing to be vocal around especially adolescent health and family planning, and those groups will continue to be active in those areas. We need technical assistance to make sure that these areas are covered in the investment cases, and this underscores how important it is to be both monitoring what goes into the investment cases, which right now are not very publicly available, as well as once they are being implemented, how there is accountability around the implementation of the investment cases. So this is a very important point, and I think that this is a point that all of us will continue to focus on as we go forward. I will say, just to end on a positive note, that I think that the appointment of Marian Clayson as the new director of the Secretariat is going to be a positive development. Miriam is very devoted to MCH and to family planning. She worked at the World Bank for 15 or 17 years, so she knows their mechanisms very well from the inside. And she's coming from Gates, so she has a vested interest from the donor and partner side to the GFF. And so I think that for these areas that we hope to see as really being fully developed as a result of the GFF, such as adolescent health and family planning, probably her appointment is a positive step, and we will see more focus on these areas because of that. But of course, stay tuned. She hasn't even started yet. She starts on October 1st. So with that, we are going to close this webinar. Thanks to everyone who participated. And as I said, we will be making the presentations available. Please look for them because they do provide much more detailed information on all of the country level work. We will be holding a webinar in French in just 25 minutes, so we're happy to be able to do this both in English and in French to be able to get as wide a group of participation as possible. And we will continue to hold these webinars as we go forward. Mesfin, maybe you can just remind us when the next IG meeting is?
Yeah, I'm not sure. I have to look at the calendar. Sorry, I don't have front of me.
November in Tanzania.
November in Tanzania. Okay, great. Thanks, Kadi. So anyway, we will continue to make this platform available for everyone, and hopefully we will see a lot of positive evolution between now and November. So with that, thanks to everyone, and please keep doing the good work that you're doing, and have a good rest of your day. Thank you. Bye-bye.
Thank you. Thank you, Christine.